So next is informed consent. Very, very important topic because I'm very weak in it. So what are the key components of informed consent? Consent is a partnership with the patient. It gives patient information they need and want in terms they can understand. It explains options, including potential benefits, risks, burdens, and side effects of each option, and the option to have no treatment. Patient must be given time to make a decision and should not be consented on the day of the surgery. No one else can make a decision on behalf of an adult who has the capacity. Can you delegate consent to another member of the team? Ideally, it's my responsibility to discuss consent with the patient if I will be performing the surgery. If I can delegate, if the junior doctor is trained and qualified, has sufficient knowledge of the proposed operation, understand the risks involved, acts in accordance with the GMC guidance. What level of the risk would you mention? This depends on the individual patient and what he or she wants or needs to know. Adverse outcomes that may result from surgery as well as those from not operating must be identified. Risks include side effects, complications, and failure of intervention. So risks include side effects, complications, and failure of intervention. The patient must be told if surgery might result in a serious adverse outcome, even if the risk is very small, might affect the decision to consent. These are referred to as the material risks in the Montgomery versus Lanarkshire Health Board case. Patients also must be told about more common, less serious side effects and what to do if they happen if the patient. How can a patient give consent? Patient can give in three ways: verbal, written, or implied way. If there is no time to get a written consent, ruptured AAA, verbal consent can be relied upon, but the patient must still be given all the relevant information to make the decision. I would then record in the case note that fact that the patient has given verbal consent. A child of 13 has acute appendicitis and her parents cannot be reached. Can you proceed with the surgery? A child's capacity depends on the ability to weigh up options and make decisions, not on the age. Children under 16 may have capacity to make decisions. It is the responsibility of the doctor to decide whether the child is GILIC competent. If the child is not competent, there is no need to delay an urgent operation if parents cannot be contacted. A 57-year-old man has been admitted with a stercoral perforation and is peritonitic. He thinks you are trying to kill him and refuses surgery. What would you do? 3 points. Every patient has the right to refuse surgery and his decision must be respected. You cannot force a patient with a mental illnesses to accept a treatment, even if this means that the outcome may be fatal. You cannot force a patient with a mental illness to accept a treatment, even if this means that the outcome may be fatal. The patient still has the capacity to make decisions about his or her own care. The only treatment that could be forced on the treatment is the treatment of mental illness. Mental illness can be forced after consulting with the psychiatric colleagues. What is the Mental Capacity Act? This is the legal framework from 2005 regarding treatment and care of the patients who lack capacity. It presumes that every adult has a mental capacity to make decisions about his or her care. If a patient lacks capacity, treatment options that provide overall clinical benefit of the patient must be considered. Previously expressed wishes such as the advanced directives and the views of the people close to the patient and whether those beliefs are in the patient's best interest must be taken into account. If there are no close relatives or categories, then IMCA means independent mental capacity advocate must be involved to decide whether elective treatment is in the patient's best interest. In an emergency setting, a patient can be treated without consent provided the treatment is necessary to save his or her life. Thank you.